Hello and welcome to Introducing M5. In this video, I'm going to walk you through some of the main EHR tools that are built into M5. Let's get started by looking at the calendar. I have this calendar broken out for a single doctor who's using 2 rooms. On the first column, I can see all of the patients that are scheduled for the day and any open slots that I have for that physician. In the second 2 columns, I can see my rooms and how the slots are broken out evenly or dispersed the way that's necessary for seeing patients today. Along with this, we have different views that can be opened, like a week view, maybe even a month view, give you an idea of where you've got open slots for that particular doctor, or we'll just take it back to a day view. Along with the rooms and the patients, we can also have other equipment shown or different resources. This gives us quite a variety of flexibility to show the necessary information when scheduling a new appointment, and then also overview of what's taken place so far. Within this, we can also break out the different slots which are necessary for the different appointment types. We can go all the way down to 5-minute slots, which make your appointments nice and large. The flexibility of this is that we can have multiple doctors from multiple locations with multiple different types of resources in a very easy to use screen. Let's move on now to the list view for this same doctor. Today's appointments is a custom list of patients that are scheduled to be seen in the practice today. Each today's appointments list is customized for that particular user. This list is laid out for a doctor who has 26 patients scheduled that day, and of these 26, you can tell which ones have arrived and are ready to be seen. This list can be sorted in a variety of different ways depending on who you are and what you want to see. One of the things I really like about this list is I can turn on the statuses that are most important to that particular physician. This helps me cut through the clutter and get right to the patients that are being taken care of at that time. I can also, though, expand and look at the whole entire list. Who's being seen for what reason, some of the details about them. It's a great way to keep on top of what's taking place, where people are, and where they're being moved to. I'm in today's appointments list view and I'm looking at Cora Abbott. She's one of the patients that was in the office this morning. I'm going to go ahead and dictate the SOAP note for her on this visit. Patient jammed her middle and ring finger playing basketball today, period. This was her left hand, period. She immediately iced this but still has swelling, stiffness and pain with motion, period. Positive swelling of the proximal interpharyngeal joint, left middle finger, and ecchymosis noted, period. Pincer action of the thumb and middle finger as well as the thumb and ring finger is within normal limits, period. Hand grip strength is within normal limits, period. No evidence of fracture seen, period. Sprain strain of the left middle finger and ring finger. Continue icing. New line. Immobilization for 24 hours. New line. Within 36 hours she may begin using Chinese ball therapy and active range of motion, period. New paragraph. RT-CPRN problems. Now that I've got my dictation finished, I'm going to go ahead and turn it into a document and save it into the records. I've got different templates that I can pick from. This is a very straightforward SOAP. At this point I can preview it. I can look at the signature on the file. Everything looks great. I'm going to go ahead and save this. It automatically saves it to the appropriate folders and sections of the chart. And from here I'm going to fax this document by going into the records. I'm going to go ahead and send this as a fax. And I've got all the pertinent relationships already presented to me here. So I'm going to send this off to the referring provider as well as the primary care doctor. They'll each get a copy. I can go ahead and put some more information in here in regards to the subject, but at this point I'm just going to go ahead and fax it. So it's going to send 2 copies with a cover page for each to each of the recipients. It's as easy as that. Thank you for watching. Give us a call and let's find out if M5 EHR is a fit for you.